Okay, so what happens when people come in presenting with bilateral sciatica or numbness, tingling and numbness in both legs, both hips, hamstrings, or below the knees? Anytime you have dysfunction below the knees, whether it's pain, burning, numbness, it's usually related to the sciatic nerve if they are also having symptoms somewhere above. So when they come in with bilateral pain, everything changes. You have to change your whole thought pattern, because usually as the nervous system runs, things are one-sided only. So when you have a bilateral symptoms of sciatica, there are a couple of things that can be. Both of them or neither one of them are. Both of them are not good. One of them is called spondylolisthesis, where the pars interocularis, this little bone right here, cracks and allows the body of the vertebra to glide forward, pinching both sides. On both sides, it pinches both sides of the sciatic nerve. If you see somebody that comes into your practice with excessive lordosis, too much sway back, they're coming in complaining of bilateral pain or numbness, tingling in the legs, in the hips, in the buttocks, don't put them on their stomach. Matter of fact, send them out for an orthopedic workup before you even deal with them if they've had this problem for a while, because you could have bilateral cracking, and if you put them on their stomach and start putting downward pressure, you could crack them more. So you don't want to be doing that. The other condition is something that no one works on that can be helped by manual therapy. At least I've had some success with it. Phil Greenman at Michigan State showed this technique in class one day, actually showed a film of working on an elderly woman with this condition, and it's spinal stenosis. Spinal stenosis is simply calcium that has built up from degenerative disc disease, which is flattening of the discs and approximation of the bodies of the vertebra, and it starts to cause the ligaments, the anterior longitudinal ligament, particularly the posterior longitudinal ligament, to be lax, and it starts to create calcium buildup inside and around the spinal cord. That calcium in and around the spinal cord is calcium lactate, and it is not the hard, crusty stuff that is present when it hits oxygen, which when we usually see it in dissection or something like that, embalmed dissection. That's very, very hard calcium, and it looks like you can't do anything with it, but you really can in most cases. So at least give it a try. So here's a real great little technique. It's the old miracle roll that the chiropractors use. That you set them up just like you do in the old miracle roll, and those of you who have ever had a chiropractic adjustment have definitely had this before.